And yeah, please just interrupt if something isn't coming across clearly. All right, so we're going to get started here. Good afternoon. Thanks again for your patience as we are setting up our technology here. Welcome on behalf of the National Medicine Division. A reminder, as you heard the notification, we are recording this meeting. Today is Monday, November 13th, 2023. It is 3:34 p.m. My name is Dominique Mignola, and I'm the Senior Director for the Colorado Department of Revenue's National Medicine Division. Today, we are hosting our 6th listening session to inform our stand-up of the regulatory framework for natural medicine operations here in Colorado. Today's session continues our conversation about how the department will fulfill the statutory directive to provide first responder training materials. While we will begin our official rulemaking in 2024, which will also provide more opportunities for stakeholder engagement, the topic of today's session is really focused on the development of training materials, which the department is anticipating starting to roll out sooner than later. So we're looking to do that leading up to even the end of this year, if we're able to start getting certain materials out. I am joined by my co-chair, Allison Robinette, Director of Policy and Regulatory Affairs for the division. We are also joined by our colleagues with the Department of Regulatory Agencies, including Sam Barami. Sam is the Senior Advisor on Natural Medicine Services and has been working really closely with the Natural Medicine Advisory Board. And we appreciate the collaboration with Sam. And joining us from the Colorado Department of Law, we have Christine Maria and Kate Olson here with us today in the room, and Ross Hide also with the AG's office, maybe joining us at some point online. We have 3 more sessions planned prior to the end of this year, which we'll cover before closing out today, so everyone is aware and marking that on your calendar. I'm going to hand it over to Allison here to take us through some logistics for our participation.
Thank you, Dominique. And as I mentioned in the chat, please bear with us. We're trying to switch to the audio to make sure it's coming through clear. So we'll be working on that. And before we get into any really important information, we'll make sure that is as clear as possible for you all. As for today's meeting, thank you for joining us online. As you can see, we also are attending in-person meetings. And this meeting is being recorded as a mentioned. This chat is available to focus on the discussion, but you can chat with me as the meeting host. So again, if there are any questions or information you want to share directly to me, please feel free to do so. When we open up the floor for discussion, we ask that you come off mute and introduce yourself, including your name and the organization you represent. And if you're joining our Zoom meeting using a phone today, you can raise and lower your hand by dialing *9, and you can mute and unmute by dialing *6. We'll be monitoring this meeting and ensure we are reserving enough time for anyone who wants to make a comment and contribute to this open discussion today. So we'll now just briefly hit on, like we have in our other meetings, the role of the Department of Revenue in the regulatory program. So under Proposition 122, and now under Senate Bill 23-290, there are 3 aspects of the changes in the law as it relates to national medicine. So first, regarding personal use, the law allows use of national medicine, including allowances for personal cultivation and perspective. For personal cultivation, adults can cultivate national medicine on private property, which is defined in the statutory provisions, and that area must be enclosed, locked, and cannot exceed 12 feet by 12 feet. For personal possession and use, there is no personal possession limit, and adults are allowed to share with other adults, so all adults over the age of 21, for reasons that are listed in the statute. For example, within the context of students and guidance, maybe ways to use. And if you're looking for more specific information about rates and fines, we'll be read us to 90. A summary of those resources are available on the National Medicine website. And there are also restrictions, prohibitions on personal use established under state laws. For example, when sharing, you cannot accept payment for natural medicine, and this is, to be clear, not a commercial regulatory program either. You're not going to see dispensaries or stores like you would in cannabis space for natural medicine. And then as it relates to regulatory programs for natural medicine, the law directs the Department of Regulatory Agencies or DORA to license and regulate facilitators. Those are persons approved by the state to administer natural medicine developed in regulated environments. And DORA is also facilitating the National Medicine Advisory Board to make recommendations to both of the agencies regarding rules and specific areas outlined in those guidelines. And the last piece I'll highlight here is that the law directs the Department of Revenue to license and regulate service centers, cultivation, manufacturing, and laboratory testing facilities. There are a handful of other assigned responsibilities, including data collection and reporting, and the development of public education and first responder materials. So we have sessions that are more targeted towards other topics that we in our previous sessions. In previous sessions, we've also provided more background and detail about the department's responsibilities under the National Medical Code. Those meetings are recorded and available on the division website, and I'll share those links with you in the chat here in a moment. So you're welcome to peruse those materials as well as our public resources folder, which includes all of the recordings, all of the slide decks, and all of the agendas for our previous session. So with that, I'll go back to the we're going to just touch on, as we did in our previous sessions, an overview of the requirements in the law that we're focusing on today. Today's session is, again, the second forum in which we are focusing on the legislative mandate directing the Department of Revenue to develop training materials for first responders. And you can see how the language is displayed directly in Senate Bill 290. Focusing on developing, promoting the training materials for first responders and multi-responders, including law enforcement, emergency medical providers, social service providers, and firefighters. Before we jump into additional material, we thought it would be helpful just to recap the takeaways from the previous listening session related to first responder training material. So, and before we do that, why don't we try to troubleshoot our audio real quickly, because I don't want anyone to miss this before every class with additional resources. So everyone bear with us for one moment. We're going to try something different with our audio, and then we will come right back to you.
All right. Okay, perfect. Okay, great. Thank you so much for working with us, and we're really glad that you can hear us more easily at this and clearly at this point. Okay, so really jumping into our recap of our takeaways from the last listening session on first responder training. So we did create a summary document. This is something we're going to try to do as we're able to in preparation for future listening sessions. Is if we already held a listening session on this topic, is just create a summary that highlights the takeaways that we got from the conversation, recognizing again, these recordings are all available on our website along with other materials, but this is supporting our overall work, and want to make sure that we think about ways to create materials that are helpful to our collective work, and as well as to where it may provide opportunity or prompt you to provide additional context or feedback based on how we have summarized our takeaways. So we'll also make this available, accessible on our website after this meeting. So again, this last listening session was held related to first responder training, was held on September 12th of this year. And the summary of stakeholder feedback, in that feedback, we're focusing on, where we touched on initial identified target audiences, and you can see some of those target audiences for first responder training material are expressly outlined in statute. But we want to make sure that we are getting your feedback on other professions of first responders or other folks we should be thinking about for these types of materials. And so other professions that have been identified thanks to your feedback include veterinarians, And that's for purposes of considering accidental exposures to animals and potential inappropriate guidance about treating animals with natural medicines. We also heard about the value of ensuring that we are including dispatchers in these conversations. And as we think about training materials, mental health professionals, hospitals like emergency room department staff, harm reduction organizations, as well as crisis response teams, including mobile crisis services. As it relates to curriculum considerations, we want to make sure that we're continuing to hear from you on how we approach our prioritization and focus of curriculum for first responder training materials. So what we learned from the last session was interest in ensuring that we're focusing on knowing the law around personal possession and consumption, as well as including appropriate bases for stops, searches, seizures, and arrests. An overview of variations of natural medicine products that first responders should expect to see out in Colorado, and what would be able to be possessed by adults 21 and up. An understanding of attitudes and beliefs around natural medicine. And so I would be interested in feedback on how we approach that work, and I could see us potentially even looking to partner with other departments where there may be value and information we can gain, as well as other organizations. And so want to hear from you all on that. Adverse events and risks tied to natural medicines, including risk mitigation strategies, adverse event data. There was a mention and discussion around serotonin syndrome or toxicity as a nervous system response that we should learn more about and make sure that materials that we're developing touch on, as well as terminology. What words, what terms we should be incorporating into training materials, including what to avoid, and how important this is to ensuring effective education and effective interactions between first responders and those that they are interacting with. Of course, an awareness of cultural practices. There was a discussion in the previous session around purging experience that may be an intentional part of the experience with certain natural medicines. There was a focus and discussion around behavioral health response. So initiatives that are focused on reducing arrests and hospitalizations or involuntary commitments that could, from some perspectives we heard, cause more harm than help. And so we want to make sure that we are leaning into that and understanding that more. Also mention of online trainings that are offered by the Behavioral Health Administration, I believe, as I have summarized here. Triaging protocols that we should be considering and learning more about, and crisis response services or intervention practices. There was also discussion around the unarmed response opportunities. So there was mention of unarmed, even if we're talking about law enforcement or plainclothes officers. And the law enforcement response, that could be involved is considerations around how that could be coupled with unarmed services like mental health professional support that is also being provided. And there was mention of ensuring that we're thinking about and pulling together more information around questions that dispatchers should be asking when responding to calls related to natural medicines. We have discussed even outside of this, these listening sessions, how just wanting to learn more about some of the expectations of what first responders may encounter in different scenarios, including a response at a private residence compared to a healing center, and whether there are important distinctions around what first responders may face, as well as the potential of environments that may involve manufacturing with certain hazardous materials and where there could be risks associated with that. I do understand in Senate Bill 290, there are some express prohibitions on certain materials that can be used that are deemed hazardous. So we will want to highlight that, I think, in some of the materials that we're developing. And then there were some examples of other curriculum, including from MAPS established training, mention of fundamentals of psychedelics, recognizing and responding to psychedelic crisis, and responder liability. So that is our summary of takeaways, recognizing there was a lot more discussion, but this is our, what we pulled together and wanted to highlight with all of you to inform today's conversation before we get into some of the discussion questions that we provided ahead of time. There's some more material we want to cover as well. So are we good to transition to that? Okay. So with the feedback that we heard in the last listening session, and the work that we've done so far, and before we get into the discussion questions for today, we also want to share what we are thinking at this point, and specifically as it relates to our initial approach to implementing this mandate around the development of training materials for first responders. And so we welcome your feedback today on these items as well. So first, as part of our due diligence, we think it's going to be really important for us to engage in more direct outreach to various first responder groups. This we see as important to helping us further understand the distinct needs of various first responder groups, specific questions they have or particular knowledge gaps, any unique challenges they face, which could be resource related or based on the region in which they work, which could inform certain activities they're more likely to see than in other parts of the state, just as an example. This can also inform how we prioritize, as I mentioned, our development of resources and curriculum. And as we also appreciate the feedback that we heard about the value of creating forums for different types of first responders to come together. Example, creating a forum, a space for law enforcement, paramedics, and mental health professionals to come together, offering a more holistic approach to learning about how each respond to calls related to natural medicine. And as it relates to our development of materials to supplement existing training programs, that's something that we want to focus on as well and anticipate doing more work around. So, and this is related to the direct engagement I just noted. As a part of this, for us, is to understand what first responder groups at both the state and local level are doing now with their existing training programs, and where there may be gaps that our work here can help fill around natural medicine. So it'd be helpful for us to understand what trainings are required as well, and what is voluntary for first responder groups, and how first responders envision incorporating natural medicine trainings into their programs. And to be clear, we interpret this directive to us to develop these training materials under 290 as not specifically requiring first responders to be trained using the materials we're developing. That said, whether or not they are required, we want to ensure what we are doing ultimately enhances awareness about these new laws and supports consistency in how first responders enforce new laws and how they serve the public. For example, POST, and that's peace officers standards and training developed and for several years have been delivering trainings to law enforcement regarding Colorado's cannabis laws. Curriculum includes civil liability issues, defenses, traffic stops and searches, possession, home grows, and more. And the purpose of this program is to provide a comprehensive understanding of the legal framework for cannabis in Colorado. So, we intend to engage more on this front and understand what existing training programs look like and where we can support, supplemental materials to help create this awareness and support that overall work. So also, as we look forward to our ongoing implementation, as we've previously shared, the stand-up of this program will be an iterative process. All the work we're engaging in now is about getting to our first iteration of implementing Proposition 122 and Senate Bill 290. The same applies to this aspect of our work, the development of training materials for first responders specifically. So we see this first phase of our work is really critical to helping us analyze any future needs to effectively implement this program. Those needs could be in the form of funding or third-party assistance to support ongoing training and or training materials. However, before we can suggest or justify any such needs, we really want to be diligent in our assessment and ensure that we have data to demonstrate how we're carrying out this work with existing resources we were provided, and where we see any limitations on this front. And finally, as it relates to reporting on our implementation progress, we intend to report out on our implementation work. We're already doing some of this, for example, in these forums and in full board meetings facilitated by DORA. However, Senate Bill 290 also requires the department, in coordination with DORA, to report out on our implementation. So consistent with that expectation, we intend to track and document our progress, and we see this as keeping us accountable and supporting transparency. So I'm going to hand it over to Allison to walk us through our discussion questions that we provided previously. Some of this may be a bit duplicative, but we want to make sure that we're touching on these items again and digging more into some of these areas.
Thanks, Dominique. And as you said, some of these may seem familiar to questions that we first raised in the September 12th listening session, and that we see these listening sessions as building on one another to help inform future implementation, ongoing implementation. And so the questions that we're hoping to hear from folks on today, as well as any comments that folks have generally about first responder training materials, about some of the pieces and topics that Dominique raised earlier. So really free form here, but for today, let's talk about what research and data is currently available to inform the development of training materials for first responders. And then also wanting to zero in on what are the primary subjects that first responder trainings should focus on in this initial implementation. Some examples could be just knowing the law, personal consumption and possession requirements and limitations in the law, identifying impairment, and do existing resources like drug recognition expert training appropriately cover natural medicines. And then thinking too about crisis and harm reduction services. Are there areas that we could leverage or that we need to build further out with additional training materials? And that kind of leads into the next question. What are the perceived gaps in existing training materials, and how can the state best fill those gaps, whether that's through in-person trainings, webinars, handouts, pamphlets, those types of resources. And then, as always, through the lens and perspective of Indigenous and religious use and spiritual use of natural medicines, how can this historic and traditional knowledge help inform what we are incorporating into our training materials? So with that, unless there's anything else you want to add?
No, I think we really want to take the rest of this time to create some dialogue, to hear from our attendees and in reaction to the questions that are displayed, but also everything else that we've shared about our takeaways from the previous session and some of our thoughts around our approach to implementation.
So for those of you who are online and you wish to make a comment, please go ahead and start raising your hands. As I said at the beginning, we'll try to work through hands that are raised in the order that they're raised, and welcome any feedback you all have. We're taking notes. Of course, this meeting's recorded, so we can always refer back to this. And I'll just keep filling the airtime until I start seeing some hands pop up. I did want to flag for everyone also that this conversation is meant to complement and also kind of move simultaneously as the Natural Medicine Advisory Board Subcommittee on Emergency Response, Harm Reduction, and Ethics. They're having similar conversations, but this is really focused on those first responder training materials. Yes, Rita.
Hello, I didn't join right away, so I don't know if you guys covered something. I want to ask you the drug recognition expert training. I want to kind of see it. And I also wanted to let you know that I subscribed myself to one of the training program by Oregon, and it definitely has a harm reduction program. And I really like that specific program because the doctor that presents everything, and she's MD, she's also easy to listen to, easy to follow, and it's kind of fun to listen to. She makes it fun. So because a lot of those I've tried and they kind of put me to sleep. So I don't know if you guys looking for somebody to prepare it for you, or what are you basing on? Just wanted to understand where this is happening. Where is this all right now?
Thank you, Rita. So we'll just touch on a couple of things that we covered earlier, including that we are approaching this work specifically as it relates to the directive to develop training materials for first responders, is that we would initially be looking to develop materials, with the resources we have within our agency, but also recognizing we are not suggesting we are the experts in this space. And so with that is needing to make sure that we are learning from what trainings already are out there, working with other agencies, with other state agencies, as well as other groups like hospitals and harm reduction organizations to understand what materials are already out there and how that can support our development of materials that we would be providing to first responders.
So I just put in the chat that that website that I'm suggesting. It's a Right to Heal. Erica Zelfand is a doctor there, and I'm pretty much listening to anything that Erica puts in. She's been in psychedelic space for many years now, and she's also a medical doctor. So that's
great.
Yeah,
Thank you for the
really
resource.
good program.
And similarly, if other attendees have would like to share particular resources that you all have seen as relevant and could inform this work, we welcome that.
And I also wanted to ask you, since this is the Department of Revenue, I would suspect that Department of Regulatory Agencies will be the one who is pretty much creating training, right, or not?
So there are two different types of trainings, and want to make sure that we're not creating confusion around that. So the Department of Regulatory Agencies, in addition to facilitating the advisory board meeting discussions, will also, as it relates to our licensing responsibilities, DORA will be responsible for licensing facilitators. And I know that there are a lot of conversations around expectations that there will be training requirements for facilitators. So that is separate from what the Department of Revenue is charged to do. And Senate Bill 290 separately requires the Department of Revenue to develop training materials for first responders. So for law enforcement, for firefighters, paramedics, for example.
Gotcha.
Yeah.
No, I understand. And you're also going to do harm reduction and everything else from perspective of manufacturing, cultivation, right? Just in healing centers, just not from perspective of facilitator.
So yeah, yes, when it comes to our the expectations that we are licensing and regulating healing centers, cultivations, manufacturing facilities, that we do see opportunity to ensure that we're looking at what sort of educational materials or trainings that we are developing or researching to support compliant operations and also just overall awareness around issues like harm reduction. We're also going to be responsible, aside from that work and the first responder training materials, to develop education campaign material for the public. And so that will also be work that I'm sure we'll be doing in a very collaborative nature.
So I also really like one of the podcasts. I'm listening a lot to those, that was in regards to ethics in psychedelics facilitation. And that's the one that talks about religion, indigenous practices, spiritual practices. And if you want, I can probably email it to you. I don't know, I need a little bit to find it. It's
Sure, no problem at all. We appreciate that and welcome that, even if it's after the meeting.
Thank you, Rita. We'll go next to Tim Lane.
Hi, guys. This is Tim Lane with CDAC. I just wanted to let you know, along the lines of the drug recognition expert, that we have an in-house expert here that trains a lot of law enforcement. She's our traffic safety resource prosecutor. She's under a federal grant under the National Highway and Traffic and Safety Administration. So if you need any resources there or need more information on what is already being trained on, feel free to reach out to me. I can get you connected there. They have a pretty robust training on basically every type of drug, including psychedelics. But obviously, if you're looking to do more, be good to connect with them to make sure you know what is being trained on already.
That'd be great. Thank you, Tim.
Other comments or questions, feedback?
I have a comment, but I can't find my hand to raise.
Please, go ahead.
I just wanted to introduce myself. My name is Robert Hayes. I work for the International Association of Chiefs of Police, and I'm the Western Region Project Manager for the Drug Recognition Expert Classification Program for the Western states, and Colorado is one of my states. And I work very closely with Mark Ashby, as well as the Traffic Safety Resource Prosecutor. So just letting you know, I'm on the call. If there's any questions regarding the program, I'd be more than happy to assist and try and answer them for you.
Excellent. Thank you so much. We appreciate that, and we'll certainly look to follow up.
Thank you.
And while we're looking to see if others are wanting to jump in with any comments, feedback, or questions, want to again touch on some of what we gathered from the last first responder training listening session, and to the point that Tim Lane had made, that a part of this is also, again, understanding what already exists out there for purposes of identifying what we might be able to support as far as like supplemental materials, or separately areas that may already be covered, so that we can acknowledge, document that, and have that inform where else we focus our work.
Great, we'll go to Peter Pryor.
Thank you. So I'm a medical doctor and worked at Denver Health and helped train medics, paramedics, and was the medical director of the paramedic school there for a bit. I've been doing medical marijuana for the past 9 years. And so I kind of bring an interesting blend to this, but I've been having a hard time figuring out how to plug myself into anything useful that's going on now. Is that fairly common, that it's just hard to find a way to be useful for this, or is that going to be, are there going to be more opportunities in the future, or how should I plug myself in to this system?
So there will be plenty of opportunity to continue to engage, and I mean, your attendance here and listening into what we have gained so far, and hearing any of your insights, as well as other avenues that we'll be providing to provide input. But this is it's helpful just to have you here as a start. We'll share that we are going to be hosting additional series of listening sessions like this, that we're also, as you can see, trying to create some, space for in-person attendance where there's an interest, but recognizing the convenience and still ability to have robust engagement virtually. So we'll be looking for more opportunities like that, and invite you to be a part of those conversations. Now, as we go into the new year in 2024, we will be initiating the more formal process that will involve our formal rulemaking. We're at this stage at this point of really trying to understand the perspectives, insights, subject matter expertise of others. And so when we are referring to these as listening sessions, our hope is really to hear from you, from others who have important information they can provide to support our overall implementation work. And as I had touched on earlier, I know we had covered quite a bit earlier, so I just want to recap this, as we also anticipate needs to do more direct outreach and engagement with various first responder groups, with various organizations like hospitals or law enforcement agencies, paramedic groups, firefighters, to have more targeted conversations around, where we can gain learnings around what expertise you all have, and bring that back to share those updates and report that out in these listening sessions, as well as in the full natural medicine board meetings. So we will make sure, and we've had all this information available on our website, so I want to make sure that we're directing you to that, so that you can see what we've done so far, but also that's where we'll be posting all other engagements, and so you can see exactly where there are those opportunities to participate, and we appreciate that, your participation.
Thanks. I just have had a hard time getting any traction. That I've communicated with a couple people, and what I've been told is just that they're not supposed to communicate with the public. And I'm like, well, how do you participate in this if the people that are figuring this stuff out aren't supposed to communicate with the public. So I'm just looking for a way to be helpful.
For sure. No, I appreciate that. And also if Sam Barami is on, maybe we could look to you, Sam, to touch on this further. This may be a matter of the distinction between the role that that our department, the Department of Revenue, has in this implementation work compared to the work that the Department of Regulatory Agencies is doing, which includes engagement with the Natural Medicine Advisory Board. And there are specific limitations on what that engagement can look like when it comes to formal board member meetings.
Yeah, I'm happy to speak on that. Hey, Dr. Pryor.
Hey.
So at the Division of Professions and Occupations, and the policy is that board members cannot individually speak on board matters outside of board meetings. So the stakeholder engagement piece for them is prohibited for the division policies on that. We have non-voting participant roles, but as we're in kind of our finalized recommendation period before it's submitted, and the regulatory authorities, so the two agencies and as well as CDPHE, that's when we'll begin our stakeholder engagement piece on the draft rules and need public comment on that. But I think when we discussed previously is being proactive and not reactive. So I think this is a good example of that, the listening sessions, as we're trying to consolidate what resources are out there, right, on trainings for EMS and law enforcement, and what resources already exist and how can we consolidate that or create a format to where we can provide these resources to the proper authorities, right? I think that's kind of a challenge too with the nature of like advisory boards or boards with authority is engaging with them. But since we're in the early process for this board where they're making their first consolidated recommendations and submitting them, we still need we still need further public engagement and stakeholder outreach that we necessarily can't do in that small window that we have the board members in. Happy to follow up and discuss how we can best engage with the board and what we'll be looking to people like yourself and the cohorts at CU Anschutz on as we get into the rulemaking period where we're going to be asking for public comment and opinion on the recommendations as they're drafted as rules.
Thank you, Sam.
Right. Next, we have Jordan Leister.
Hi, thank you, Allison and Dominique. I'll start with just sharing gratitude for the Department of Revenue and doing this work. Really appreciate the thoughtfulness that's gone into having an open dialogue around these things, and it's clear that there's care and consideration in this, so I just wanted to share that gratitude. In regards to the discussion questions, I'll throw a link in the chat here of, if it's not already known, the 21 approved training programs that the state of Oregon has approved for licensed facilitators. Most of those curriculums are public, even if the programs themselves are at cost. So just aggregated resources for your review. And then I wanted to call out the Integrative Psychiatry Institute that's based here in Colorado, led by Dr. Will Vanderveer and Dr. Keith Kurlander. They've been doing training of psychedelic medicines for quite some time, predominantly in the legal psych.
Sorry about that, Jordan.
Go ahead.
No problem. Just calling out that organization has been training facilitators for quite some time of legal psychedelics like ketamine. Really incredible work, and they do have public education and content that's available for review. So I wanted to call out those things. I've also personally gone through a couple of those programs, personally working in the corporate side of ketamine therapy and consulting for a few years. One of the gaps that I've seen in education services is understanding of trauma and nervous system responses. So just wanted to call that out, that many times individuals that are having a challenging experience or having are reverting to past trauma and essentially a post-traumatic stress disorder or trauma response. So just wanted to call that out as a potential gap in some of these training programs that I've seen with a couple of years of industry experience. So thanks again, all.
Thank you so much. That's really valuable information for us just to be looking into, following up on, making sure that we have, if we haven't pulled that information to inform our work yet, certainly want to make sure we follow up on that. And also thinking about how it seems that some of this may overlap with the work that we're also doing and expectations that we're also generally creating public education materials beyond what's specifically intended to be targeted for first responders, and do see some overlap there and value and exploring how some of those existing trainings that that you've taken or that others have done, or maybe even would be contemplated for facilitator training, is how are we evaluating the potential of value of looking to that to inform what we're doing around first responder trainings.
Thank you, Jordan, so much for your comments. We'll go now to Jeff Mignani, and please correct me if I ever pronounce your name wrong for anyone.
Yeah, thank you. That was good. Yeah, so one thing that occurred to me to wonder about with current first responder training is what kind of training they get, and whether we can see documents about this online or somewhere regarding if somebody is needing treatment, ideally a person would go voluntarily, but as a nurse with 8 years of experience in mental health, I know that sometimes people have to receive involuntary treatment, and the guidelines for that is that the person has to be a danger to themselves or to others or gravely disabled. So can we see what guidance first responders receive on determining those things, like particularly in reference to if somebody appears to be intoxicated with a substance? And then my other question is, if somebody did require involuntary treatment in the current system, would they be taken to an emergency department as opposed to some kind of detox facility? Do you know?
Thank you for that question. That's something we could I think we would need to look into more. An example that I had mentioned earlier is the Colorado Peace Officer Standards and Training program that includes a specific program that was developed by Post for law enforcement marijuana specific training. And the information that is publicly available is, touching on the curriculum, examples of the curriculum. And that's what I had covered some of, which includes civil liability issues, possible defenses, investigations, home grows, traffic stops and searches. So it has a list of subjects that are covered in that training, but doesn't provide the full content of that training. And so those are things that we would look to as a part of our research, is what is public and what for other reasons may not be. And if it's not, what are we gaining from these listening sessions and other research as we look to do more direct outreach and have touch points with various groups like Post on this front to see where we might be able to get insights, more insights into the content of that training and support further development of that potentially by sharing the insights that we're gaining from these sessions and from our other work. So that's one example of how we would look to approach some of that.
And I wanted to add on to that real quickly. If anyone on the call today has information or contact information for other groups outside of Post, we're also thinking about other types of first responders, such as firefighters or dispatchers or behavioral health responders, and helping us understand if there are sort of uniform training programs offered to these other types of first responders that we could do that additional work to dig in and see what's being covered, what isn't being covered, and what materials we could be providing. I think that would be really helpful so that we can identify common threads that either we can expand on, or if there aren't common threads, then that's going to be really indicative as well as materials we could be developing.
Yeah, thank you. And I forgot to mention the specific statute, but it's 2765 that applies for involuntary treatment.
Thank you.
Thank you.
And I think also Allison and if there's other comments around this, wanted to just share this thought of as it relates to law enforcement, is even looking to see if there's value in connecting with academies on that front.
Yeah, exactly. Great. We'll go to Erica Messenger.
Hi, everyone. I'm a registered nurse with 11 years experience in rural health and home health and perioperative care and community health. So without actually knowing any of the existing training materials that are out there for first responders, the first thing that comes to mind is just helping them to understand the difference between, as Jordan said, a challenging experience, a medical health emergency, and a mental health emergency. The challenging experiences can manifest as one of those other two emergencies. So just distinguishing between the two, and the facilitator will have some training on that as well. But the assumption is that if a facilitator is calling a first responder to wherever the facility is, the healing center, probably they've recognized that this is something either A, they can't handle, or it's gone beyond a challenging experience. But just having them understand what a challenging experience could look like, distinguishing that between challenging experience and something like serotonin syndrome. And then going along with that, if someone is really not able to handle that challenging experience, it's just too overwhelming for them, or they are actually in a serotonin syndrome, just understanding what some of the rescue medications are, like benzodiazepines, 5-HT, 2A receptor blockers, and just understanding when and how to use those versus, just letting them kind of ride it out in a challenging experience.
Excellent. Thank you. I'm sorry if I cut you off there, Erica.
No, it's okay. And then how just to understand that these situations could go to something, worst case scenario, suicidality, which they all have training in. So kind of going towards that. And then as far as the crisis and harm reduction services, I don't know if there's anyone from Zendo or Fireside Project on this call, but they are the top right now for harm reduction services. So I would say consulting one of those folks on the best use of training for first responders for that.
Great.
I think that's all my notes.
Great. And I believe we heard from some representatives from one of those groups and one of the previous board meetings. So we can follow up on that too.
Yeah. And MAPS, MAPS has a training manual online that's free. I think the last time it was updated was 2013, but that's that MDMA facilitator training manual. Yale has a psychedelic or a natural medicine, psychedelic assisted therapy, and I think it's specifically for psilocybin. So they have a training manual that's available online. There's several of those that can be consulted for just things that have been used in research. So those would be good resources as well.
That's great. And I think even it's just other thoughts and in response to what we're hearing here is what other sort of interim steps are we taking before we dive into actual development of what could be these training materials, is what other information are we specifically gathering around what existing training programs provide for various first responders, and could envision something somewhat similar to, I don't know if a survey is the right term, but sort of a guidance document based on what we're learning here. An example being, in our direct outreach to various first responder groups is providing a certain outline of what we're learning and asking them to perhaps assess and that inform sort of a later touch point with us to understand, like, does your training currently cover the differences between a challenging experience, a medical emergency or mental health emergency, and seeing where we might want to look to leverage these listening sessions to further define exactly or examples of what, those are, to inform first responder groups and considering what they may, look as gaps in their existing programs. And, before we show up and suggest that we're here to provide all these training materials, is thinking through what, assessing what those needs are and what those programs currently cover.
Great, we'll go
Sorry,
to-
just if I could just jump in one more second, Dominique, so one of the board members, and I know that there's they can't really cross over a whole lot, but I wonder if they can be consulted, but because one of the natural medicine advisory board members is, I believe, a paramedic, and I believe he does a lot of these trainings. Sam might be able to fill in on that, who that is, but
Will Dunn, he
Yeah.
was supposed to be here today, but he was unable to make it, unfortunately.
Okay. Yeah, that's a shame. But anyway, he'd be a great resource.
So we'll look to follow up with him on this in a manner that's, of course, appropriate with the restrictions around board member engagement, but could even look to work with Sam and seeing how this conversation informs further discussions in those board meetings.
Great, Kristen Spear.
Hi, thank you. My name's Kristen Spear. I am a board certified pharmacist and co-founder of the nonprofit Psychedelic Pharmacist Association. Appreciate the opportunity to be able to speak with you all today. I agree with and reflect a lot of the sentiment and ideas of those who have spoken so far, especially with Erica Messenger. But I think what I'd also like to add in addition is maybe including the topics surrounding withdrawal reactions. I think this is a big gap in the community, especially when it comes to emergency services. So, we're focused a lot on, and rightfully so, on identifying impairment where you might have related to alcohol or psychedelic medicines or whatnot. But I think there's a lot of potential for folks who are really eager to stop certain medications so that they can participate in healing that psychedelics offer. And with a lot of the misinformation and disinformation floating around the community about how to taper off medications appropriately, whether they be SSRI medications or opioids or even benzodiazepines, can be very dangerous, but also very painful and extremely symptomatic in ways that sometimes look like impairment or toxicity, and other ways do not. And they can be managed differently. So I think that's an area of focus that might be added to training materials for first responders.
Thank you. I think that also seems to touch on some of what we heard in the last session around the behavioral health response, and how some of what you just shared can inform the initiatives, as we noted and will be available on the summary, focused on reducing arrests and hospitalizations or involuntary commitments that could, we heard, create more harm than good for some folks in these scenarios. And so looking to that behavioral health response as a focus in these trainings to see where do those programs that exist already cover this, and what could we potentially emphasize, highlight based on what we're learning here, and bringing that to those first responder groups.
Yes, and I wanted to also kindly request or offer up here anyone who has resources like you just flagged, Dr. Spear, resources, information that you can share with us. I'll make sure and include my email address into the chat. It's going to be really helpful, not only as we are developing our own resources, but because we also want to be a central location for information that someone who is looking to explore on the personal use side could also find these resources and information. So for anyone out there who has, whether it's a podcast, whether it's a study, whether it's an article, just resources generally are going to be really helpful as we continue forward on our implementation work. Great, Erica.
Just one more thing. Dr. Spear brought up some really good points, and it reminded me that a lot of the facilitators are going to have or may not be medically trained. Also, there's going to be a screening process by which people are going to find out if the participant has certain medications on board. But what they're not going to know is certain things like if they haven't had a diagnosis of a particular condition, mental health or medical, because they haven't been to the doctor in, let's say, 20 years, particular medications that they choose not to divulge during a screening process. So I would suggest that any sort of interactions of psychedelic medicine or natural medicine with any sort of drugs should be part of the training program so that they understand when there's an actual reaction that, let's say, a wellness facilitator wasn't aware of. But also these interactions that can happen with certain mental health conditions that may not be divulged or may be undiagnosed, understanding what those look like as well.
Great, thank you.
Thank you for those comments so far. Any other comments or feedback or questions? We recognize that we have put a lot of questions and information in front of you all, and so certainly understand if you need time to think about and digest kind of where we're at, where we want to go. So this is not the only forum to provide feedback or to raise additional information. You're always welcome to reach out to either Dominique or I as we continue to plan for future listening sessions, as well as our rulemaking and more formal implementation.
And as we take everything that we're learning from these sessions so far and see how that will inform our development of other outlines of materials, maybe suggestions of some next steps that we're looking to take in this work, we want to make sure that we're sharing that with you all. And so that would be information that we publish on our website and also send out to anyone who signed up to receive updates from the Natural Medicine Division. So just a reminder that if you are not signed up to receive updates, we encourage you to go to our website, and you'll see prominently displayed on the side a section there for you to be able to sign up to get those updates, because we want to make sure that we're giving stakeholders an opportunity to react to what we are developing, what next steps we're anticipating, and then providing feedback on that.
Yes, Jordan.
Hi, ladies. Sorry, I was reviewing the questions, and on the side of the indigenous, religious, and spiritual use of natural medicines, I'll just share another resource, a nonprofit named the Chakruna Institute, a nonprofit that has aggregated a lot of indigenous and historical facilitators of plant medicines. And I know they have a ton of resources on some of the indigenous treatments for individuals under the influence. So again, just another resource more alluding to the indigenous and religious use versus the kind of the medical model and some of the training materials that are out there. So just wanted to call that out.
Thank you for highlighting that. Another area I know and I touched on this from the highlights from the last listening session on this topic is, and would be interested in more input if there is any that you all would like to share today or after this meeting is it relates to terminology, recognizing we are going to be really leaning on what is expressly, referenced in the statute and the law on natural medicine, but just generally through the lens of training materials for first responders, as well as our work that we'll need to be doing around public education campaign materials is what terminology should we be really sensitive to and avoiding and why, as well as where we should be adjusting to other specific terminology. So just wanted to throw that out there as well.
Wanted to recognize that while our first set of listening sessions were each 1 hour, all of the sessions we have planned now through the end of the year will be between 90 minutes and 2 hours. So if you were thinking, oh, it's 4:30, we must be getting on time, we still have plenty of time. So welcome your comments and feedback. And if there isn't any, that's also fine. We can wrap this up and give everyone back some time of their day.
And as we continue these sessions, we'll be thinking about what other, beyond what I had mentioned of different steps we would be looking to take and wanting to get feedback on, initial outlines of things that we're developing for stakeholders to react to, that we'll look to see how we are preparing those in advance of listening sessions to support more dialogue and other things that we could be focusing on in these listening sessions. But just as Allison noted, if with what we've shared, and we appreciate what we've gained from this session, if we're slowing down with comments, we certainly, it's fine for us to wrap up a bit early. And we have plenty of feedback that we appreciate we've gained from you already.
That was perfect. We gave enough time for a couple folks to raise their hands. All right, Rita.
Sorry, guys, one more. I understood that Sam is here from DORA. And Sam, the probably question for you. I'm trying to understand, you guys going to design some kind of a protocol for people to apply for certified training in Colorado. So approximately when is it going to be done, and what can you tell about that? I know there's some things not to be told, but what can you tell about it?
Hey, Rita. Yeah, so with the board, we have a subcommittee, qualifications, licensing, and training. They're working on the licensure structure for the facilitator occupation, as well as identifying the required education and expanding on that. In statute, there's 7 statutory requirements for education. The board in that subcommittee has discussed expanding that. The education requirements, we've also heard from folks who've gone through training programs in Oregon and also have approved training programs in Oregon. IPI, Dr. Will Vanderveer has been on that subcommittee. He was on that subcommittee today. And we were discussing hours for education. So the timeline is still the same, right? We have the board submitting recommendations to the 2 agencies on quite a lot. But we expect recommendations to be submitted in a report to the 2 agencies, as well as CDPHE in early 2024, where after that, once that's submitted and finalized, we would file for a rulemaking notice. DORA would file for a rulemaking notice, and DOR would file for one as well regarding their statutory requirements. And I guess the main date to keep in mind is that the application portal, the licensure portal, is supposed to be up and available no later than December 31st, 2024. So that's the last possible date that a portal for applicants could be up next year, but it could happen sooner. It really just depends on where the board is on their current iteration of recommendations for a whole lot of work, right? Emergency response, safety and ethics, and public education campaigns, which they've taken the conversations from the previous meeting here, and we're discussing that, and products research and data, indigenous religious use, public health and health equity, and then of course qualifications, licensing, and training. So those will be consolidated recommendations to the regulatory authorities for rulemaking. And then we hope to have that up next year as soon as we can. It just depends on the rulemaking process and the feedback we get from folks, and what we can implement. So
I specifically was asking in regards to certification for the classes, training classes, or this is also going to happen after
yeah,
beginning
so
of
that's
this year,
also
right?
that's also part of the rulemaking process. Yeah.
Gotcha. Appreciate it. Thank you.
Yeah, no worries.
Right, Rochelle Gailey.
Hello, thank you all for being here today. My question is around, will there be a portal or something like that to report critical incidences if there were med diversions or deaths or other things that we might want to track for practice improvement reasons?
That's an excellent question, and want to make sure that we're hearing from you too, Allison, on this. Is we do anticipate standing something up like that, a process like that. We certainly don't want to recreate the wheel where there may already be established processes that we could make sure that we are building this into, and creating awareness around. For example, just as it relates to our regulatory work within the Marijuana Enforcement Division, we do have a process for receiving reports of, one example being adverse health events, and that's prompts coordination that we engage in with our partners at the Public Health Department, where we assess those and determine really where that falls within our scope, but in a supportive and partnership manner, and making sure that we are responsive to those things. And so that's just one example, but something that we do see as important here is understanding that there needs to be a place to report certain incidents.
Yeah, and I'll add to that. I think that is a great question. Ditto everything Dominique said. Wanted to also highlight that there are overlap with our data collection reporting requirements and statute. So one area that we are required to collect data on is related to law enforcement incidents, adverse health events, behavioral health impacts. And so we're exploring opportunities to work with our partner agencies on who may already be collecting this information, and if there's a way to streamline and centralize the reports, for example, of adverse health events or of interaction with law enforcement related to natural medicine. And so that's all part of this work of figuring out how can we best set up a system that someone knows clearly where they should be going if they want to report any incidents.
And when it comes to our development of materials, education materials, education campaign materials, is making sure that we are, identifying what existing places there are for us to direct folks to report certain incidents. An example being, poison control, Rocky Mountain poison control, where there is an established process for that. And so making sure that we know those resources for reporting, and are making that available, creating awareness around that.
Seeing no other hands, I think we can start wrapping up.
Okay, well, as we're getting close to wrapping up here, want to just touch on, I know Allison did at the beginning of this meeting, but recognizing we had some audio challenges, want to cover some of what we anticipate we will be creating materials around as it relates to just knowing the law generally, that could be useful to first responders as well as just to the public in general. And so with that is, as it relates to the personal use provisions outside of even the regulatory program we'll be standing up, is understanding the allowances around personal cultivation. And when it comes to personal cultivation, that's limited to an area of not more than 12 by 12 feet on private property. That space does not have to be contiguous on property. A local jurisdiction may allow cultivation exceeding this space limit. That said, I think another important point that is a big distinction from the cannabis program and framework we have here in Colorado is, again, this is not similar in that you won't see dispensaries or stores for natural medicines. And this is not a commercial program, as Allison had touched on, that there is still there is a restriction on local jurisdictions' ability to prohibit this type of activity within their jurisdiction. Unlike the cannabis space, and at least with our regulatory program, there's that opt-in expectation and dual licensing that won't apply here for our regulatory program. So just wanted to highlight that as a side note. Also, the law defines private property and notes that it's not a violation if the person is 21 and over. The cultivation area is locked in a dwelling on the private property, and this is somewhat similar to the personal cultivation provisions you see for cannabis, at least in this area, is if an underage person lives at the dwelling, the cultivation must be enclosed and locked. If there is no underage person at the dwelling, the external locks on the dwelling constitute an enclosed and locked space. Also, there is an allowance for persons who are 21 and up to share natural medicine, and there is not a personal possession limit for natural medicine, unlike in cannabis. So those are some of the things that we anticipate developing some more specific resources around, perhaps at the start here, recognizing the personal use provisions of the law are already in effect. So that just gives you at least some initial insights as to what you will probably be seeing from us here soon as we develop and begin outlining materials. So as we look to wrap up here, we should touch on the next set of meetings that we have coming up. So with that, November 29th, we will have another listening session, and that will be focused on data collection and public education campaigns. So maybe some overlap from what we heard today, which is great. And December 11th, as we get into December, we're going to be holding a listening session on cultivation and manufacturing practices. Then December 21st, that will be a virtual only meeting, and that's where we will be focusing on, as it relates to our regulatory program, business structures and licensing processes that we can expect, as well as eligibility. And so we will be diving into that detail, and we haven't touched that yet. So that'll be a new topic for us. Allison, anything else to touch on before we wrap up?
Thank you all for joining us today. If you are interested and able to join in person, we welcome that as well. And if not, we'll see you online at the next session.
Thank you very much. Have a great evening.